Good morning, everyone. I, Dr. Shagun, welcome you all to another session of Cancer Care at American Oncology Institute, Gurugram. Today's topic of discussion is prostate cancer. To discuss this topic, we have Dr. A.K. Dhar with us. He is an eminent medical oncologist and has expert in treatment of all kinds of cancers. He has got special interest in treating prostate cancer. He has treated all kinds of prostate cancers, particularly patients with advanced stage disease with hormonal therapy, chemotherapy, and has taken special care of bones in prostate cancer. I welcome him on behalf of AOI Gurugram.
Thank you, Dr. Shagun.
So, what is prostate cancer?
See, prostate cancer, if you see that it is the disease inside the prostate gland. Now, before we go to prostate cancer topic itself, let us understand what is the prostate gland. Actually, prostate gland is a gland which is less than the size of a small walnut, and it lies in the urogenital system of males. So that indicates that it is not found in female. And it is an important organ in producing secretions for semen and helps in the sexual process. Now, when the prostate cells, they get stimulated, maybe any kind of stimulus it may be, whether this is iatrogenic, this is acquired, this is genetic induced, the cells, they start dividing very fast. The mutational changes happen. That is very important. Mutational changes are the DNA changes. And these mutational changes, they cause prostate cancer.
Sir, can you tell us how common prostate cancer is?
Yeah. When I joined oncology, when I started my career as an oncologist, we hardly got any patients of prostate cancer. But over a period of time in last 4 decades, the number of prostate cancer patients have increased, both globally as well as in India also. Now you may understand the fact that prostate cancer is very common in United States as compared to India. If you take the statistics, in India about 5 to 10 patients out of 1 lakh people will develop prostate cancer per year, while this number increases to 110 to 180 in the United States. So you can understand the magnitude of prostate cancer globally in United States of America as well as in India also.
Sir, is prostate cancer fatal, and what are the methods to detect prostate cancer?
If you call that prostate cancer is fatal, I will not agree to that statement, but yes, it needs attention. Because to begin with, in most of the patients, mind the word that most of the patients, the growth of the disease is slow. And if we catch the disease at early stage, we should be able to treat that particular patient. But if somebody comes in advanced stage disease, the disease has gone to the bones, disease has gone to the lungs. I have seen patients where the disease has gone to the brain, liver. That stage, it is difficult to treat. It is difficult to treat, but I will not say it is not untreatable. So, my message or my information to the audience is that don't leave the patient of prostate cancer considering that it is an advanced stage disease. Every stage of prostate cancer has to be treated depending on merits and demerits.
Sir, can you guide us with the common manifestations or symptomatology of this disease?
Yeah, symptomatology is very important, particularly people who are after the age of 60 years. They should watch out these symptoms which I am enumerating right now. The commonest symptoms are lower urinary tract symptoms. So what is lower urinary tract symptom? Lower urinary tract is bladder, urethra and urethral aperture. The patients will have increased frequency of picturation. They will have increased frequency during the night. They may have obstructive symptoms. Obstructive means they are not able to evacuate the bladder completely and they have to rush again and again. Then they may have pain and some people may have blood from the urethra. So these are the symptoms which you have to watch out, particularly once the person crosses the age of 55, 60 years, you start monitoring these symptoms.
So, what are the stages and outcomes of this disease?
See, prostate cancer has got 4 stages, stage 1 to stage 4. Stage 1 to stage 2 is confined to the prostate and they are called early stage disease. But as we progress, as we go ahead, we may have stage 3 and stage 4 disease also. And as far as the outcome is concerned, this is also very important for the audience to note and audience to listen, that if we diagnose prostate cancer in early stage disease, the chances of cure are very high. It is a dictum in United States that if the prostate cancer can be operated and is removed by operation, the chances of survival become more than 90%. But if somebody comes in advanced stage disease, when the disease has spread out of the prostate gland, the chances of survival decreases. But nevertheless, we have treatment for these patients also. So any patient of prostate cancer, whether it is early stage, advanced stage, or any kind of stage, has to be treated based on the indications and the type of modality of treatment which we are going to give to the patient.
So, can you tell us about the treatment modalities of prostate cancer?
See, as far as I have already told you that surgery should be done in all prostate cancer, provided, there's a big word, provided the disease is operable. Not that we start operating the disease which is not operable. The second modality of treatment is hormonal therapy, which has to be combined with chemotherapy, or it can be combined with secondary hormonal therapy. And radiation also plays an important role as far as palliation is concerned. Primary treatment of prostate is concerned. So there are various indications. It depends on at what stage the patient comes. But here I want the audience to note that recently there has been some newer substances, newer molecules which has been used in the treatment of prostate cancer, and that too in patients with BRCA1, BRCA2 patients, and that is called olaparib. And this medicine is available with American Oncology Institute, and it may produce wonderful results.
Sir, can you mention about the recent advances in management of prostate cancer?
The recent advantage has come as far as the surgery modalities of treatment is concerned, few radiation techniques, and as I have told you, very important molecules, the medicines, like we got secondary hormonal therapy, we got newer chemotherapy modules, and we have got olaparib, that is for breakup patients.
Sir, if patient undergoes upfront surgeries, does he require further treatment?
Yes, yes. It depends on the stage of the disease.
Sir, how does one monitor the disease?
See, monitoring of disease has taken several turns in last few years. The most important thing in monitoring of disease is monitoring of prostatic specific antigen, serum testosterone level, then digital rectal examination, then different kinds of scans. And these are the things which we monitor after we have completed the primary treatment.
So in the last, any message you want to give to the audience, sir?
See, my message to the audience is that screening is very important. Prostate cancer screening is very important because if we catch the disease at the early stage, we may get more than 90% results. And screening should start somewhere between 50 to 55 years of age with the serum PSA level estimation. And second thing is the digital rectal examination of the prostate. And one thing more is that why we are conducting all these programs are that by these programs we get knowledge, and knowledge kills the cancer. So that is very important. And lastly, I will say, which may sound little surprising, is that those patients who have got family history of breast cancer, their blood relations or siblings, their prostate cancer are also positive for BRCA1, BRCA2 genes, which are also found in breast cancer. So be at lookout for these BRCA1 and BRCA2 genes. So to conclude this talk, I will say that we need not to be scared of prostate cancer. I will call prostate cancer as a curable disease if we catch it at early stage. In advanced stage also, we need to treat the patient. The patient's responsibility or patient's job is to come to our hospital, American Oncology Institute. We got all the facilities for treatment. We got PET scan, we got radiation, we got chemotherapy, we got hormonal therapy, we got targeted therapy. Every kind of therapy is available with us. And we are giving good results to the patient as far as prostate cancer treatment is concerned. Thank you very much.
Thank you, Dr. Dhar, for this informative session. Thank you, audience, for watching this live session. Stay tuned.